Hello, everyone, and welcome back to my weekly presentation. And in this week, we will wrap up the evidence-based practice playlist. This is a final presentation for this playlist. And in this presentation, I'll just highlight some important concepts. So to start, the definition of evidence-based practice as per the Institute of Medicine is a systematic approach to clinical decision-making that integrates a decision-making process informed by three elements. These three elements are the best available evidence, the clinical expertise, and the patient values. And the aim of all of that is to provide a high-quality care. So there are 5 steps for evidence-based practice, and each step of these steps I have presented a separate presentation, and you can find that in my YouTube channel if it happened that you missed those presentations. So the 5 elements are the 5 A's, as we see here. First one, we start by asking questions. And to ask the clinical question, you formulate a clear and focused clinical question using the PICO method. And then you acquire the sources. And we use the mesh terms to search and retrieve the relevant evidence. And then we accumulate our sources and appraise them. So we discussed that in our journal club presentation or clinical appraisal presentation. And here we critically evaluate the quality and relevance of the evidence that we got. And then we assess our evidence, and the assessment is discussed in the presentation of the evidence hierarchy. So we make our assessment according to the hierarchy of the evidence base and depends on which study type is higher on the hierarchy, which is more valuable than the others. And that helps to evaluate the outcomes of the interventions and refine the process for future decision making. And then we apply what we got by integrating the evidence with our clinical expertise and patient preferences, of course, because the patient is the center of our healthcare. So these are the 5 steps. And as I said, I have a presentation for the PICO method. I have a presentation for the mesh search. And I have a presentation for the journal club or clinical appraisal. And I have a presentation for the hierarchy of evidence. You find all of that in my YouTube channel. Okay, so there is systematic evaluation for evidence done by big organizations. We will mention some of them here just for reference. So the general evidence-based organization are such like the National Institute of Health, the NIH, based in the United States, the Institute of Medicine, IOM, also in the United States, the Agency for Healthcare Research and Quality, the AHRQ, the Centers for Disease Control and Prevention, well known as the CDC, and specifically, the CDC is concerned with the disease preventions and guidelines and public health recommendations, and it's a well-known institution for everyone. We also have the National Institute for Health and Care Excellence, the NICE. It's also well known for clinicians, the NICE guidelines for almost every disease that you might encounter, and it's based in the UK. And it provides evidence-based guidance on, almost every healthcare intervention that you need. We also have the Cochrane collaboration, and this is an international organization, and it also produces and disseminates systematic reviews and meta-analyses. And I think we mentioned that when we spoke about the best databases to look for evidence, specifically if you are looking for meta-analyses or systematic reviews, the Cochrane database is the best database to look for that. So other than the organizational evaluation, there is a reader evaluation for evidence. And we have to know that there is no single study is perfect because each study must have some limitations, some biases. That's normal. Just you have to consider some elements while reviewing the evidence. So you remember to check the study design and the sample size and representation of that sample size. You need to look at the blinding of the study and the validity and reliability of that study. And most importantly, the statistical analysis used and all in all, the consistency and relevance of data that's between your hands. So in this presentation, I just highlighted, as I said, important information in general for evidence-based, and the rest of the presentations about the specific information for each of them is available in my YouTube channel. Please make sure to watch them if you are interested, and if you like them, please subscribe for the channel to keep the channel grow and to keep me consistent in providing this knowledge and sharing the word between all of us. Thank you so much, and I appreciate you.